Good morning. Good morning. Let's talk about the personality of an injury. Uh, what am I referencing when I talk about that? It means that the same injury is not going to behave in the same way in any two people. For example, let's take a 50, 55-year-old who's going outside to check the mail, slips on a wet leaf, twists their knee, and tears their anterior cruciate ligament. Now, let's say that patient does not have instability or the feeling that the knee is going to give out and buckle on them on a daily basis. Let's say they never have those symptoms. Let's say the knee bothers them a little and they go to the physician's office and their physician orders an MRI. The MRI reveals a tear of the ligament and perhaps even a tear of one of the meniscus cartilages. Now, what is that physician going to recommend? They might recommend surgery simply because the ACL is absent and there is a tear seen on the MRI. Let's talk about patient number 2. Now, patient number 2 is a 17-year-old. She plays a lot of soccer. She sustains a non-contact twisting injury, which incidentally is the most common cause of an ACL rupture. She feels something pop in her knee. Her knee swells tremendously. She's seen in the office. She initiates physical therapy. She's referred for an MRI. The MRI confirms the presence of an ACL ligament tear. And in follow-up, after her swelling goes down and she's worked in physical therapy, she complains that her knee is buckling and unstable. Now, which of these two patients do you think best qualifies for an ACL reconstruction? Obviously, it's our young little girl who's active who has an unstable knee. Sure, she has an option of wearing a brace around the clock or not participating in sports anymore. Obviously, an ACL reconstruction is not an urgent procedure or emergent procedure or a life or limb preserving procedure. However, even if you are an adult and your knee is buckling and giving way, you are at risk if your knee gives way and you're on a ladder, on your roof, on a hill, climbing a tree, or even going downstairs. So patients with instability of the knee can consider an ACL reconstruction. But back to my point, I think the personality of the injury in this young girl is quite different than our 55-year-old that we talked about. It's clear that the 55-year-old does not require surgery. The indication for an ACL reconstruction or the indication for meniscus surgery is not simply based on the presence of an MRI finding. It must be put into context with the impact that this issue is having on the patient's quality of life and of course, whether or not the patient is willing to change their lifestyle. Take, for example, another patient. Let's say that 50-year-old used to ski 3 times a year, and maybe they have some instability feelings with skiing. Does that mean they need a reconstruction? Not necessarily. They could try physical therapy to see if that strengthens them up enough. They could try a brace, or they could give up skiing 3 times a year. So you have options, and those options are always present. Make sure to go over all the details with your surgeon. You need to let your surgeon, and your surgeon should inquire about what impact the injury is having on your quality of life, and whether or not you can pursue certain activities or whether or not you're willing to let those activities go. They're all very important considerations. So remember, help your surgeon to define the personality of the injury and how this injury is directly affecting you, the patient, because after all, we're all patients. Have a good day.